Toothpaste says do not swallow. So why do we drink fluoride every day?
Look at your toothpaste label. It clearly says, do not swallow. If swallowed, call poison control.
So here of the uncomfortable question.
Why are we told not to swallow fluoride in toothpaste? Yet many people consume it daily in their drinking water.
Fluoride exposure. More than just toothpaste. Fluoride is widely added to municipal water supplies to help reduce dental cavities.
Historically, this practice began in the 1940s,
When fluoride toothpaste and other sources of fluoride exposure were far less common.
Today, however, the situation has changed significantly.
Fluoride exposure now comes from multiple sources.
Toothpaste, drinking water, coffee, tea, soft drinks, processed foods, and infant formula prepared with fluoridated water.
Because of this, the total fluoride dose individuals receive can vary widely depending on age, health status, and daily habits.
Unlike medications, water fluoridation does not allow precise dose control.
infants, athletes, and people with kidney disease may receive significantly higher exposure
Relative to body weight compared to the general population.
Dental fluorosis, a visible sign of overexposure.
One well-recognized effect of excessive fluoride during childhood is dental fluorosis.
A developmental condition affecting tooth enamel.
Dental fluorosis occurs when children are exposed to too much fluoride while their teeth are forming. It typically appears as
white spots or streaks on the teeth, chalky or opaque enamel. In more severe cases, discoloration or surface irregularities.
Research suggests that a substantial proportion of children show some degree of fluorosis.
Even in regions where fluoride levels are maintained at what is considered optimal for cavity prevention.
While many cases are mild,
The condition serves as an indicator that fluoride exposure exceeded the level required for enamel development.
Systemic absorption fluoride does not stay in the mouth. Fluoride used in toothpaste and drinking water does not remain limited to the teeth.
Once swallowed, it is absorbed through the digestive tract and distributed throughout the body.
Scientific studies have shown that fluoride can accumulate in several tissues, including bones, kidneys, thyroid tissue, the pineal gland, which plays a role in melatonin regulation, because the kidneys are responsible for excreting fluoride. Individuals with reduced kidney function may have higher retention levels over time.
Fluoride and brain development, ongoing scientific debate.
Another area of active research concerns potential neurological effects of fluoride exposure during early development.
Several epidemiological studies have reported associations between higher fluoride exposure and lower IQ scores in children.
these findings have prompted further scientific review and debate within the public health community.
While researchers continue to evaluate the strength and consistency of this evidence, the topic highlights an important principle in environmental health.
developing brains may be more sensitive to certain exposures than adult systems.
A public health trade-off.
Water fluoridation was introduced as a population-wide strategy to reduce tooth decay.
Particularly in communities with limited access to dental care.
However, modern exposure patterns are far more complex than when the policy was first implemented.
Today, many experts are asking an important question. If fluoride's primary benefit occurs on the surface of the teeth, should systemic exposure through drinking water still be the primary delivery method? This question has led some countries and municipalities to reconsider or modify fluoridation policies.
While continuing to emphasize oral hygiene and reduced sugar intake and targeted fluoride use in dental care.
Managing personal fluoride exposure.
For individuals who wish to reduce fluoride intake, several water treatment technologies can help lower levels, including reverse osmosis systems, distillation specialized filters certified for fluoride reduction. Standard carbon filters commonly used in household pitchers or faucets typically do not remove fluoride.
So it is important to verify filtration specifications when choosing a system.
Fluoride remains one of the most widely debated topics in preventive dentistry and public health.
While it has played a role in reducing cavities,
Modern exposure patterns raise important questions about dosage, systemic absorption, and long-term health effects. Understanding where fluoride comes from and how much we are exposed allows individuals to make informed decisions about their water dental care and overall health.
Thank you for watching.